Welcome back to TV5 News at 9. Today we are talking about chronic venous insufficiency with the Center for Vein Restoration. Joining us this morning is Dr. James Sheppe, physician's assistant, Laura Scott, and patient Rosie Prevey. Thank you all so much for joining us.
Thank you. Good morning. Good morning.
Good morning. Now first, doctor, tell us a little about your clinic and what chronic venous insufficiency is.
We are the Center for Vein Restoration. We have multiple clinics across the United States. Our clinics are located in Lansing, Saginaw, to be coming soon, and Midland. We treat the broad spectrum of venous disease, which includes chronic venous insufficiency, which is the failure of the valves in the legs, which can cause heaviness and achiness of the legs, unsightly varicose veins, blood clots, sores and ulcerations, swelling of the legs, all the way through to cosmetic spider veins.
Okay, and Laura, what are some of the risk factors for chronic venous insufficiency, and what are the most common ways to treat it?
Well, the risk factors definitely are pregnancy for women, being over the age of 50, jobs that require long periods of standing, injury to the leg, surgery, and definitely there is a component of family history.
And so, Rosie, tell us a little bit about your experience at the center and why you chose to go there.
Well, I can tell you it's wonderful. I was made to feel very comfortable immediately, which really helps when you're going under procedures. I originally came here because I was having heaviness in my legs. I also had a blood clot, and I was also having swelling. So we went through 4 weeks of procedures, and I can tell you I feel great.
Well, that is so good to hear. And Rosie, would you like to tell us a little bit more about your treatment plan and if it actually improved your leg health?
Well, of course it did. Like I said, I was feeling heaviness and pain in my legs and swelling. And because I stand on my feet for 8 hours a day, I found I was getting tired all the time, and now I'm more energetic. I no longer have any pain or swelling.
And doctor, what would you tell someone who's experiencing this and has never had it looked at?
I would advise anyone with leg symptoms of any sort to be evaluated by their primary care physician or to call our clinic. We'd be happy to see people for any leg complaint. We start with a free evaluation for some people, even to prescribe stockings and counsel leg health. But we can get anybody into the pathway.
Yeah, okay. Well, that sounds great. And thank you all again for spending some time with us and speaking to us about this morning.
Thank you.
Thank you.
And if you would like any more information, you can head over to the hot link section of WNEM.com.